Hi everyone, Nurse Jenny here from Nurse Life Academy, and I will be reviewing questions and concepts related to acid-base balance that you must know for the CCRN exam. I would greatly appreciate if you like and subscribe to my video if you found it helpful. Now, when it comes to acid-base balance, the CCRN is not going to ask you 20 acid-base interpretation questions. They really want you to apply this information in patient scenarios. So while this is a review on acid-base problems, once you have this mastered, I would highly recommend focusing on the application of this information and the conditions which are associated with the four main acid-base imbalances. Question number 1. Which of the following are acidic blood gas values? Is it A, a pH of 7.33, HCO3 of 18, PaCO2 of 32, B, a pH of 7.05, HCO3 of 30, and PaCO2 of 48, C, a pH of 7.28, HCO3 of 18, and a PaCO2 of 50, or D, a pH of 7.46, HCO3 of 30, and a PaCO2 of 32. And the answer is C, a pH of 7.28, bicarb of 18, and a PaCO2 of 50. Question number 2. Which of the following are alkaline blood gas values? Is it A, a pH of 7.32, HCO3 of 26, PaCO2 of 32, B, a pH of 7.50, HCO3 of 18, and a PaCO2 of 32, C, a pH of 7.52, HCO3 of 18, and a PaCO2 of 50, or D, a pH of 7.46, HCO3 of 30, and a PaCO2 of 32. And the answer here is D, a pH of 7.46, HCO3 of 30, and a PaCO2 of 32 are all alkaline values. So let's quickly review normal values and which values are considered acidic and which are alkaline. And if you don't have these memorized right now, you have to. Right now, we're going to focus on only 3 of these on the left-hand side: our pH, our PaCO2, and our HCO3, otherwise known as bicarb. Those are the values we'll be looking at when we interpret our ABGs. A normal pH is 7.35 to 7.45, and a pH is considered acidic when it's less than 7.35, and it's considered alkaline when it's greater than 7.45. First things first, carbon dioxide is an acid, and bicarbonate, or HCO3, is a base. Again, if you don't have this memorized, stop right now and memorize it. You need to know this in order to continue on. Alrighty, so now that we've gotten that out of the way, a normal PaCO2 is 35 to 45. And since carbon dioxide is an acid, when there is a high amount of PaCO2, or when it increases above 45, it's considered acidic. And when there are low amounts of CO2, under 35, it's considered alkaline. Now, a normal bicarb is 22 to 26. And since bicarb is a base, if bicarb is less than 22, it's considered acidic. And if there is an excess of bicarb over 26, it will be alkaline. You have to commit this to memory. One extra side note here before we move on is that our bodies love balance. They love homeostasis. So when there are changes on one end, the body will compensate on the other end. And this is what acid-base balance is all about. The lungs will be the quickest to compensate, and the kidneys will be a little bit slower to compensate. Okie dokes. So we know our normal values and when they trend high and when they trend low. So let's put it all together. I like to think about acid-base interpretation in 3 steps. So we can kind of look at it as a first name, a middle name, and a last name. And the first name is the level of compensation. The middle name is either respiratory or metabolic, or both. And the last name is going to be acidosis or alkalosis. And I know that there is a lot on this slide, but let's go through it together. I promise it's not as complicated as it looks. So remember, first name, middle name, and last name. We're going to start with the pH. And let's make this super easy for ourselves. We're going to ask ourselves, is it normal or is it abnormal? And if you have a normal pH, boom, you're done. Your first name is going to be compensated. If you have an abnormal pH, you are going to be uncompensated. And that is all that we need to fill in for the first name right now. Super plain and simple, normal or abnormal, and then we'll determine the level of compensation at the very end. So let's take a look at our example here. So a pH of 7.22, is it normal? No, it's not. A normal pH should be 7.35 to 7.45. So because the pH is not normal, that's the only question we want to answer, our first name is going to be, is it uncompensated or compensated? An abnormal pH will buy you a first name of uncompensated. Okay, we're doing good. We have our first name. Now let's look at the pH again to figure out the last name. So the pH is 7.22. Is that an acidic pH or is it an alkaline pH? It is acidic. It's less than 7.35. So we're 2/3 of the way there. We have an uncompensated acidosis. All we need is just that middle name now. So step 3 is going to be looking at the PaCO2 and the bicarb and figuring out which one is trending with your pH. In our case, our pH is acidic, so we want to look at which value is also acidic. Is it our carbon dioxide or our bicarb that's trending towards acidosis? When we hear acidosis, we're going to look for either a CO2 level of greater than 45, because remember, CO2 is an acid, or we're looking for a bicarb level of less than 22. And in our example here, the carbon dioxide is 74. Whoa, that is way over our upper acidic limit of 45. So it is the CO2 that is making the pH acidotic. And this makes it a respiratory acidosis. Our bicarb is normal here, so we look good. So now we have a full name, and it is an uncompensated respiratory acidosis. All right, let's give question number 3 a try. We've got a pH of 7.16, a PaCO2 of 35, and a bicarb of 14. You guys can go ahead and pause this video right now if you want to try to get this by yourself, but I am going to go ahead and get started with all of the steps to figure this out. So where are we starting? We are starting with the pH. Is it normal or is it abnormal? That is going to give us our first name. A pH of 7.16. Is it normal? No, 7.16 is not normal. So our first name is going to be, it's going to be uncompensated because it's abnormal. Now let's figure out our last name. The pH is 7.16. Is this acidic or is it alkaline? It is acidic. So our name so far is uncompensated acidosis. All we need to figure out is the middle name now. So which of these values are trending with our acidic pH? Is it the CO2 or the bicarb? Well, the bicarb is. It is only 14 and we are lacking base. This means that the acidosis is coming from a metabolic source. Our carbon dioxide looks good here. It's normal. So the final name for this is uncompensated metabolic acidosis. Question number 4. We've got a pH of 7.20, a PaCO2 of 82, and an HCO3 of 24. Let's start with our pH. Is it normal or is it abnormal? A pH of 7.20 is not normal. So our first name is uncompensated. Now let's figure out our last name. Our pH is 7.20. Is this acidic or is it alkaline? It's less than 7.35, so we are looking at acidosis. We've got an uncompensated acidosis. Let's go through and find out the middle name. So we are looking for the value that is trending with our acidic pH. Is it the carbon dioxide or is it the bicarb that's acidic? It is absolutely the carbon dioxide. Remember, carbon dioxide is an acid and we have so much of it here. This is going to be a respiratory issue in this case. Our bicarb is normal, so we look good. So we have an uncompensated respiratory acidosis. Question number 5. We've got a pH of 7.35, a PaCO2 of 60, and a bicarb of 31. Let's give this guy a name. What's our pH? 7.35. Is it normal or abnormal? It's normal. So our first name is going to be what? It's going to be compensated. A normal pH will give you a compensated first name. Let's keep going here. What is our last name? Well, the pH it's normal. So how in the world do we figure that out? Well, fully compensated acid-base imbalances are tricky because the pH is going to be normal. So you may think, how do I know if it's acidosis or alkalosis in that case? Well, we need to look at what side they are trending towards to give us that answer. So in our example here, pH is normal, but it's on the lower end of normal and basically almost in the acidic territory. So we'll put acidosis as the last name here. And lastly, which of these two is trending towards acidosis? Well, a CO2 of 60 is acidic and a bicarb of 31 is alkalotic. So this is going to be a respiratory issue, and our full name is compensated respiratory acidosis. And when we are fully compensated, it means that our body is working hard to compensate for that excess of either acid or base. So in this example, we have a lot of acid with the CO2 of 60, and our bicarb is 31. So our body is like, holy cow, we need to start making some base to help us stay balanced. And that's why we see this high bicarb level, because it's pumping out this bicarb, it's pumping out that base to help keep the pH balanced and try to neutralize it. And it was successful, right? Since the pH was pushed back into a normal range. Question number 6. A pH of 7.50, a PaCO2 of 25, and an HCO3 of 18. Let's give this guy a name. Is our pH normal or abnormal? This is abnormal. So we are going to be uncompensated, right? Abnormal, uncompensated. And are we acidic or are we alkaline? pH of 7.50. This is alkaline. So our name so far is uncompensated alkalosis. Lastly, we are looking at our PaCO2 and our HCO3 and figuring out which one is trending with our pH. Our pH here is alkaline. So what is trending towards alkalosis? It's actually that CO2 of 25. It's alkalotic. This means that we are dealing with a respiratory acidosis. And let's just look at our bicarb. It's actually 18. That's not normal. It's not high though, so it's not contributing to the alkalosis, but it's low. So this means that the kidneys are trying to limit their production of bicarb to try to keep the pH normal, but it's not really working because our pH is still high. So if this is the case where the other value is abnormal, but it trends in the opposite direction, and by opposite direction, I mean acidosis, then you have to change the first name to partially compensated, because we have to give them some credit for working hard to try to compensate, but they didn't succeed like in the last question where they were fully compensated with a normal pH. Question number 7. We've got a pH of 7.45, a PaCO2 of 50, and a bicarb of 32. What do you think? A pH of 7.45. Is this normal or abnormal? It is normal. So our first name is going to be compensated. What's our last name? Again, when the pH is normal, we need to look at what side they are trending towards to give us that answer. So our pH, is it on the higher end or is it on the lower end? It's on the higher end of normal, and basically almost in that alkaline territory. So we will put alkalosis as the last name here. And to find out our middle name, we're looking at what is trending towards alkalosis. Well, a CO2 of 50 is acidic, and a bicarb of 32 is alkalotic. So this is going to be a compensated metabolic alkalosis. So luckily for this patient here who has a very high bicarb, the body's compensatory responses kicked in and it started making more acid to try to keep their pH normal. So it pumped out that acid. That's why we see that it's 50, and it pushed back that pH into a normal range. It did a great job, so we are compensated. All right, moving on here, I deleted our table of normal values because they are not going to give you that information for your exam, so let's make sure that we really know it. So this is question number 8. You've got a pH of 7.55, a PaCO2 of 25, and a bicarb of 23. What's our name? A pH of 7.55, not normal, so our first name is uncompensated. How about our last name? Our pH is 7.55, acidic or alkaline? It is alkaline. And what's our middle name? What is trending towards that alkalosis? It's our carbon dioxide. It's trending towards alkalosis, and our bicarb is normal here. So we have a uncompensated respiratory alkalosis. Question number 9, we have a pH of 7.20, a carbon dioxide of 82, and a bicarb of 30. What's our guys' name here? Is our first name compensated or uncompensated? Abnormal, so we're uncompensated. How about, are we acidic or alkalotic? 7.20 is certainly acidic. How about our middle name? We're looking at the PaCO2 of 82 and our bicarb of 30. Which one is acidic? It's definitely that carbon dioxide level of 82. It's absolutely acidic, which means that this is an uncompensated respiratory acidosis. But hold your horses. We have to look at the rest of the equation. Our bicarb is not normal either. It's not low, so it's not contributing to that acidosis. It's actually high, which means that the kidneys are pumping out that bicarb to try to compensate and keep the pH normal, but it's not working. Again, the one value is trending one direction and the other value is trending the other direction. So we have one trending acidosis, one trending alkalosis. We are going to change our name to partially compensated because, again, we're giving them credit where credit is due, and they are trying. They are working hard to try to compensate, but it's just not quite cutting it. While there might be a question on partial compensation, I wouldn't lose too much sleep over it. Again, it's more so about the basics of acid-base imbalance and then being able to apply them. Question number 11. We've got a pH of 7.32, a carbon dioxide of 35, and an HCO3 of 16. First name, compensated or uncompensated. We are abnormal, so we are uncompensated. How about our last name? pH of 7.32. Is this acidic or alkaline? It is acidic. And which value is trending with acidosis? It's the bicarb. We are lacking base. This means that the acidosis is coming from a metabolic source, and our carbon dioxide is normal, so we look good here. We have an uncompensated metabolic acidosis. I do want to add an extra layer here. Where would you see metabolic acidosis? When would we see our body either producing too much acid or not being able to get rid of it? Any ideas? Well, you could certainly see that in patients with diabetic ketoacidosis, or DKA. We can see it in patients with acute kidney injury and in aspirin or salicylate overdoses. So again, these questions are probably not going to be as simple as figuring out these specific acid-base imbalances, but we have to add that extra layer onto them, and that's the critical thinking portion. It requires you to apply the information. So it's important for you guys to know which specific conditions are associated with which specific acid-base imbalances. Question number 12. We've got a pH of 7.50, a PaCO2 of 44, and a bicarb of 32. What is their name? pH, normal or abnormal? It is abnormal, so we are going to be uncompensated. Is it acidic or alkalotic? Definitely alkalotic. Which one of these is trending towards alkalosis? It is our bicarb of 32, and the carbon dioxide is normal. So we have an uncompensated metabolic alkalosis. And where would we see metabolic alkalosis? If there is too much acid being removed, or if there is an excess of bicarb. So if you see a patient that is vomiting excessively, they are getting rid of acid and chloride. If someone perhaps has an NG tube to suction, that is getting rid of extra acid, or even with antacid abuse. Here is a chart of common metabolic conditions which cause specific acid-base imbalances. You definitely want to know the bolded conditions for sure, which we just went over, or at least be able to think through them. And I do cover this chart in a little bit more detail in my respiratory video, but I will quickly go over the basics. So for metabolic conditions, we are looking at the bicarbonate level, or the HCO3, which is a base. You should absolutely know this by now. But in metabolic acidosis, your body either produces too much acid or the kidneys can't get rid of the acid. So in acute kidney injury, your body is not able to get rid of excess acids, so they stay in your system and they cause metabolic acidosis. You can also have metabolic acidosis in DKA, in aspirin overdose, certain drug or alcohol overdoses, lactic acidosis, or with electrolyte imbalances such as hyperkalemia and hyperchloremia. And now in metabolic alkalosis, there is either too much acid removed or there is an excess of bicarb that's in the blood. And our stomach is very acidic because, well, we have acid in our stomach. So when we get rid of too much acid, we're left with, well, not a lot of acid, right? So we're going to be more alkaline. So if you're vomiting, if you have an NG tube to suction, or with antacid abuse or excess sodium bicarb infusion, all of those can cause metabolic alkalosis. Question number 13. A pH of 7.55, a PaCO2 of 25, and a bicarb of 22. What is our name? Step 1. Do we have a normal or abnormal pH? And is that compensated or uncompensated? It's abnormal, so we're uncompensated. How about our last name? We're looking at alkalosis here. And what is trending with alkalosis? It's our CO2. So that's going to be respiratory. Our bicarb is normal here, so our work is done. What kind of patients are going to have respiratory alkalosis? If they have a low carbon dioxide level, that means that they are blowing off a bunch of carbon dioxide. And when are you going to see that they're blowing a bunch of carbon dioxide off? Well, in early respiratory failure, when you're hyperventilating, you won't have a lot of carbon dioxide because you're blowing it off. Where else could you see this? Perhaps in patients with anxiety or those in severe pain. You want to think hyperventilation. You're blowing off that carbon dioxide so you don't have a lot left in your bloodstream. Question number 14. We've got a pH of 7.30, a PaCO2 of 50, and an HCO3 of 24. Compensated or uncompensated? We're uncompensated because we have an abnormal pH. Acidic or alkaline? We are acidic because we have an acidic pH. And what's our middle name? Well, the bicarb is normal, so it's our CO2 that's acidic, and that will make this a respiratory cause. So we have an uncompensated respiratory acidosis. Respiratory acidosis is going to occur when a patient is doing what? Well, it's going to happen when a patient is retaining CO2. And when would this occur? Well, it would occur in late respiratory failure when a patient is tiring out. We will also see it in oversedation. I'm not going to go through this whole chart in detail, but what you guys need to know is that respiratory acidosis is going to occur when your carbon dioxide level is greater than 45. We're thinking hypoventilation and we're retaining CO2. That's going to happen in late respiratory failure, oversedation, and drug overdoses that cause respiratory depression, as well as severe obesity and Guillain-Barré. On the other hand, respiratory alkalosis, we're thinking hyperventilation. We're blowing off all of that carbon dioxide, and that's leaving us with low levels of PaCO2, less than 35. This is going to be when we're hyperventilating, such as an early respiratory failure with anxiety, severe pain, fever, sepsis, or if our vent is set at excessive tidal volumes or rates. Last but not least, question number 15, we have a pH of 7.21, a PaCO2 of 50, and an HCO3 of 12. What is our name? Compensated or uncompensated? We've got an abnormal pH, definitely uncompensated. Are we looking at acidosis or alkalosis? That pH is low, so we are looking at acidosis. And what is trending with that acidosis? Well, the CO2 is 50, so that's acidic. But also the bicarb is 12, which is also acidic. So what we actually have here is a combined respiratory and metabolic acidosis. The chance of getting tested on combined disorders is extremely rare, but it does exist. And if you understand acid-base imbalances and can make uncompensated, compensated, and partially compensated names, you can absolutely do this no problem. Just do the 3 steps and make sure you look at all parts of the question and you will be okay, I promise. All right, you guys, we have made it to the end. If you liked this video or you found it helpful, please like and subscribe. I would greatly appreciate it. Let me know if you have any questions. I would be more than happy to help. And good luck to everybody taking their CCRN exams. You guys are absolutely capable of doing it and succeeding. Thank you everyone for watching. Nurse Jenny signing off for Nurse Life Academy. Have a good one.